presence of unconscious, which it must bring some significant changes for neurosis. However, this was the result after so many years, that the person, the author concludes that brings false solace to the, or some false hope. We will go on and discuss it why this happens. However, these failures of psychoanalysis made the Reich to depart from Freud, because the promise was to take whatever was discovered further, to make it to work better, refine it. And that was what Reich tried to do, and we see how this happens. Reich, Reich has written many books, but one of the essential books is Function of Orgasm, and in that book, Reich talks about one case. He actually describes that how he was treating two patients concomitantly. One patient was a young student who Freud referred to him, and he was suffering from compulsion to ruminate and count. Treatment continued according to Freud's instruction, and eventually a fantasy of incest broke through, and for the first time he was able to masturbate satisfactorily, and after a few more months his symptoms improved and the treatment was terminated. Concomitant with this case, Freud also referred another case to Reich. He was a waiter. Then the major complaint was sexual impotence. Reich describes that this man was totally incapable of having erection. He had no other psychiatric symptoms. He was a gentle and nice man. He never disagreed with whatever was said to him. He had an even temper and had only one problem, and that was his impotence. In the third year of psychoanalysis, we arrived to construction of primal scene. He was about 2 years old when his mother gave birth to a child, and from adjacent room he was able to observe every detail of the delivery. The impression of a large bloody hole between mother's legs became firmly ingrained in his mind, and on conscious level it remained only sensation of emptiness in his own genitals. Reich says that he presented this case to psychoanalytic groups, and he was praised for it by the elder analysts, and the elder analysts considered his analysis complete. And the analysis was, they said that, well, this is good work and it was done. But the patient was not improved. Reich says that he left that session unsatisfied. If he had done everything right, if he was praised for what he has done and he has gotten what he had, then why patient is not better? Why nothing has changed? So he says that there was something that no one was able to see. Something was not right in that outcome. Reich says that he terminated the analysis a few months later, and the patient was not cured. The patient accepted the termination like he accepted everything else in his life. His reaction was polite. He accepted that termination with tranquility and passive acceptance, without protest. Reich says that later on he realized that actually his illness was that tranquil and passive, agreeable character, that the impotence was a symptom on top of it, that everyone was praising that person, that he is such a nice person, but actually that was his illness, because after 3 years of analysis, not getting cured, he was not protesting, saying nothing. So he realized that actually the character is what resists the treatment. And from there on, Reich moved into character analysis versus symptom analysis. He realized that the character is what puts up the most resistance against progress of treatment. Reich, so in character analysis, the most important significance was given to the patient, the way the patient talks versus what he says. Reich focused more about how the person is talking rather than what he was saying. He says words can lie, but expressions never lie. In the pursuit of improving psychoanalysis, this technique, Reich himself developed two major theories. These two theories developed concomitantly, parallel with each other, but later on they merged and they integrated with each other. The first theory is orgasm theory, and the second theory is theory of armoring. In orgasm theory, Reich realized that patients who were able to achieve sexual satisfaction their symptoms improve, and as far as this sexual satisfaction remains and the potency continues, the symptoms do not come back. He presented his findings with the patients that he was treating. This achievement, these findings that those patients who had achieved orgastic potency, they improved, but he was antagonized by many psychoanalysts. Many psychoanalysts say that, well, they have patients who are sexually very potent, but they are neurotic. They have neurotic symptoms. Reich says that until 1923, only ejaculation and erective potency were known without the inclusion of other aspects of sex economy and experimental components. In other words, anyone who was able to have sex, they were considered to be sexually potent. And at that time, he says that he started to analyze these matters more in detail, and he realized that there's a difference. What he says, orgastic potency and sexual potency, by what others were conceiving as sexual potency. Now, I add this other line. Unfortunately, the situation is not changed even today in contemporary medicine and psychiatry. There is very little importance has been given to the matter of sexuality and orgastic potency in medicine. You cannot find one medical book who deals with it, but it is well dealt with the Reichian theories and Reich's writings. Erective and ejaculative potency are merely indispensable condition of orgastic potency, but that's not the only thing. There should be other things. I'll tell you a little bit about it. The orgastic potency, what Reich meant, is the capacity to surrender to the flow of biological energy free of any inhibition and fantasies. It is the capacity to discharge completely the dammed up sexual excitation and energy through involuntary pleasurable convulsions. Okay. I'll give you an example. Once I was treating a patient who was a woman who was very promiscuous. She was having lots of sexual relations, and also was using some substances, some drugs.